You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people that are in pain. We're talking about back pain, neck pain, shoulder pain, knee pain, hip pain, leg pain, all of the above. And we're talking about laser therapy today. This is going on across the country, and more medical doctors and chiropractic offices are using lasers to treat pain. With us, we have an expert on this topic of laser. With us, we have Dr. John Folkerts. Dr. Folkerts, welcome to the program.
Thanks for having me.
And you are an expert, right? I mean, we were talking in the green room. I mean, you're traveling around, going to these laser meetings.
We had extensive training. We've been doing lasers since 2004, and it's 80-90% of my practice. So we use it extensively.
And you were an early adopter with lasers and pain.
Yes, I was always looking for something better as far as technology-wise, rather than just doing the traditional chiropractic, which there's nothing wrong with that. We got good results with that. But once we started to go into more specific technologies, including laser, and that was in 2004 when they were first FDA approved, we started using those with carpal tunnel and shoulder and some different conditions, and our results went through the roof. I mean, it changed our practice. And our practice now
because of the results.
Because of the results, absolutely.
Is this kind of a word of mouth thing? Like when it works, obviously when it works, they tell their friends that are in pain?
Absolutely. We do. We get a lot of referrals, word of mouth, whenever patients come in and they've been to 5 different doctors, or I have patients that come in and have had 3 different knee surgeries and they're being recommended a knee replacement. They don't want the replacement, or they are overweight and they're not allowed to have the replacement. And we do the laser treatments along with our other extensive therapies and treatments on that patient, and we can help prevent the knee replacement. So basically the laser is going to the inside and it's healing damaged soft tissue from the inside. So, you know, if you've got a torn ligament, you've got inflammation, you've got tendonitis, sciatica, the laser and the lasers that we use are very powerful. They're class 4 lasers. So they're actually going to go 4 to 5 inches deep. So that laser is actually getting to that area. And it stimulates the cells to heal themselves from the inside over a series of treatments. So it's not something where it's just covering up the pain, and then when the procedure stops, the pain comes back. With a lot of other procedures, injections, you know, you get the injection, a lot of people do real well with them, but what happens when the injection wears off? The pain comes back.
So in combination with some of these injections, because you work with pain management physicians.
Absolutely.
Is that correct?
Yes.
And orthopedic guys.
Correct.
Send you patients.
Yeah,
so
we
it's kind
refer
of a
people out to them. They refer to us. It's a great combination, especially with the scar tissue. And that's one of the big things that the laser does, is soften scar tissue. And any surgery, you're going to heal with scar tissue. The problem with the scar tissue is that, number 1, it heals back tighter, so you lose mobility. And then number 2, the scar tissue has up to 10 times the amount of pain receptors in there, so that it's much more sensitive to pain. And then it goes into what's called a chronic pain cycle if it's left untreated. That's the majority of the patients that come into our office have been something they've had
So what does the laser do for these people? Like that have scar tissue? It breaks up the scar tissue?
Yeah, it softens the scar tissue, breaks up the scar tissue. It helps reset those nerves so that they're not chronically firing pain signals. So, I mean, it makes a huge difference, and especially post-surgical. And we treat, knees are the number 1 thing that we treat, and probably 25-30% of our patients with knee problems have already had a knee replacement. And the pain's not from the surgical parts or the artificial parts. The surgeon did a great job, but they've got scar tissue. And they still have pain and they don't know what else to do.
Do you have people that this has been like a miracle for them, like all of a sudden, my knee pain's gone?
Absolutely, absolutely. Okay. We had one specific patient, she came in, she was in a wheelchair, and the only reason she was in a wheelchair is because of the severity of her knee pain. So we were very aggressive with her treatment. We did the high intensity laser treatment on her. We did some vasopneumatic compression, which is a device that stimulates circulation and helps stimulate the nerves with the knees. And within 3 treatments, she walked into our office. Both my staff and myself were astonished that she got from that point to walking in 3 treatments with the laser. It was just an amazing transformation with the protocols that we did. So she actually was out of the wheelchair on the 3rd visit that she came in, which was a complete life change for her. Now she's able to drive her own car. She's able to go to the places that she can go. She can go to the grocery store. She couldn't do any of that before. Completely changed who she was and changed her life. You know, and even her mood when she came in the first time. She was obviously in severe pain, but also you could tell she was depressed. She wasn't able to do the things that she wanted to do in her life. After we finished her treatment, she was 95% better. She was a completely different person. And she had, you know, things to look forward to. She could go to the grocery store. She could go on trips. She could play with her grandkids. Those are the things that changed her life as far as her life quality, just by getting the treatment and the extensive treatment that we've done on her. When you're in pain like that, I mean, you're not in a good mood. It changes your whole life. You're not able to go eat. You're not able to interact with your family the way that you should. They see the differences in you. So, you know, just the self-esteem and the confidence of patients dramatically changes whenever we get the results.
I mean, do you think that there's people that are suffering, like within the Springfield area or within an hour of your practice, tens of thousands of people that are suffering that don't have to be? What are your thoughts on that?
There absolutely is, and a lot of it's patients just don't know that it's out there.
The laser,
and then our specific treatment protocol that goes along with the laser. You know, there's people out there that are on multiple medications that don't need to be on multiple medications. There's people out there that have had multiple surgeries that don't need multiple surgeries. And there's always a time and place for both medications and surgeries. But a lot of them are trying the same thing over and over again, and they're not getting the results. So,
what about the person watching this? They've been in pain. They've had injection therapy. They're knowledgeable about this topic because they're in pain. What if they say, "I've never heard of it. Nobody's ever brought up a laser to me"?
Well, we actually get that a lot, and the reason is that it is mainstream, and more orthopedics are using it, dentist offices are using it, physical therapists are using it, chiropractors are using it, but it's not as much accepted as the more mainstream.
Now, I interrupted you and we ended up on knees, and I want to go back to the knee in just a moment, but I asked who your typical patient was at the Laser Pain Centers of Illinois.
We do a lot of work with neuropathy. There's many patients, especially elderly patients, that have neuropathy condition. It's debilitating. They're not able to walk. They're not able to wear shoes if it's severe enough.
Is it mostly the feet? I mean,
mostly the feet, some in the hands, but 90% probably that we treat in our office is the feet. Starts at the toes and then works its way back.
But is neuropathy one of those kind of things that once you get it, that's
so
it?
If we can catch it early enough, where they're just starting to get the numbness and tingling, or they're just starting to get some balance problems. And that's one of the big concerns of my patients with neuropathy, is not as much the numbness and tingling, but basically their brain doesn't know where their feet are. And they trip and they fall and they're breaking hips. They can't drive a car because their feet can't feel the pedals. So if we can get these symptoms and get these patients in when the symptoms are early enough, and we still have tissue there to work with,
the laser could repair some of the nerve?
Absolutely.
Like bring more blood flow to the nerve?
The damage, bring the blood flow, increases the nerve activity, heals the damaged nerves as long as there's still alive cells there. So I had this one guy who had neuropathy, and it was so severe burning, he couldn't even wear shoes. He had to wear just his socks, or he wore loose-fitting Crocs because he couldn't stand the amount of pain. So obviously wasn't able to drive, couldn't wear shoes. We did our treatment protocol on him, did the Vasopneumatic Therapy, did our home FDA-cleared medical equipment, did the full treatment program on him. Actually, he came back into the office about 3 years after we treated him, which I was assuming he was coming back because he was having some issues with the neuropathy. He said, "No, I don't have any issues whatsoever with neuropathy. No pain." He's wearing cowboy boots, back to normal.
Is it true? I guess some of your patients, when they get better, they never want to see you again. They're gone, right? So you don't get to hear the good stories.
That's the goal. Yeah, absolutely. So we had another patient with neuropathy, and she, her main thing was she wanted to stay in her home. She had neuropathy bad enough where just going up and down stairs, getting in and out of a car, standing, were all very difficult for her. So it was changing her life. And she came into the office, and I remember she was sitting and she had tears in her eyes, and I asked what was wrong, thinking that she was getting worse. And she said, "Doc, I went down my stairs last night and came back up on my own." And and it was the biggest thing for her was that she said, "I'm going to be able to stay in my house now." She didn't want to go to an assisted living facility. She didn't want to go to, a nursing home. And she was seeing that she wasn't mobile. She couldn't drive. She couldn't even get down her stairs. that was
So
something
it gets them back to activities again.
gets their life
And the
back.
body, what, gets stronger?
It-
I mean, obviously, if you're moving around more.
Right. Well, absolutely, and that's one of the other things too. Is lack of activity. I tell them, the less you do, the less you do. Meaning,
Okay.
whenever you're hurting, neuropathy, knee pain, low back pain, you're not active. You're not doing the things with your friends. It affects your self-esteem. You may be putting on weight because you're not going to the gym. So the less you do, the less you do. And if you're not doing something to correct that problem, it just gets worse and worse.
Have you ever had people that get off medications?
Oh, we do that all the time.
Do you work with their medical doctors when it comes to this
Absolutely,
kind of
and I
thing?
never take patients off their medications, prescription medications. We always want to make sure that they, talk to their doctor when it's right to do that. Then they'll come off. But most patients that come in, they don't want to be on 10 different medications. They'll be on an anti-inflammatory or a pain pill. Then they've got 2 other medications to offset, some of the symptoms from the side effects from their original medications, and they want to be done with them. And that's
So
one of the things that
oftentimes, I know the doctor's not always involved in these do they slowly wean themselves off?
they do sometimes, but we always encourage them to talk to their
Okay.
physician first, and usually they're fine with it because they see the progress that's being made through there.
Low
too.
back pain. Big thing. According to Google, of course, number one reason why people go to the doctor
Yes.
is low back pain.
I think it's 80% of Americans at some point in their life.
How
will
well
have
does the laser
severe-
do with that?
We work a lot with low back pain. Now, it depends on the condition. We do a lot of work with post-surgical because of the scar tissue that builds up. We do a lot of work with sciatic patients. I had one patient that came in. He had severe osteoarthritis, severe spinal stenosis. He could stand maybe for 30 seconds to a minute before he had to sit down. He could walk maybe a minute or two before he had to sit down. So he couldn't even go to the grocery store. His life, he wanted to travel. He had a lot of other than that condition, his health was perfect. We went very aggressive with his treatment plan. We did both spinal decompression, we did high intensity laser, we did some home treatments. And his was a little unique. I think I recommended 20 treatments with him because it was so severe. So one day he comes in and he actually says, I'm doing so much better. I can walk. I walked 2 miles where he couldn't walk 2 minutes before. And it happened that quickly, even though we had a slow start to the treatment. He didn't even finish the 20 treatments. We ended up
So
not
the back
even doing
pain, the low back pain.
the low back pain, leg pain. He could walk. He had tremendous results. His life changed.
Does this work better for people that means if their pain is, I guess all pain, but from a nerve? But what if you have like a bulging disc, things like this, that's pushing against the nerve? Does a laser and the other treatments you're talking about work with these type of problems?
It does, and even with patients with severe arthritis. And I'll tell them, you've got spurring, we're not going to get rid of the spur. But your pain is from the soft tissue inflammation and the damage around that. That's what the laser treats. So,
Okay.
A disc bulge, if we're doing high intensity laser on a disc herniation, we're not going to be correcting the disc herniation. We're going to be correcting the pain, the inflammation.
Is
the
that
nerve
enough to get
irritation.
somebody out of pain?
Absolutely. Now, it's not going to, like with the patient that couldn't walk for a period of time, he had disc bulges in there too. That's where we do the spinal decompression along with the high intensity laser. The decompression is addressing the disc. The laser is addressing the nerve damage, the damage of the cells, the inflammation, the tendonitis. So we've got a combination of treatments.
Now I know you have to be careful. I'm guessing you have to be careful with what you brag about this laser can do, right? But do you ever see results that even you are surprised?
Absolutely, and he was one of them.
Okay.
And there's many, many more. And there's even a patient that I had came in about a year ago, and I did the complete exam assessment, reviewed all of his findings on nerve tests, MRIs, and I told him, I said, I can't help you. This is too severe. I don't know where else to send you, but I don't think this is going to help due to the damage of the tissue. He calls back the next day saying, I still want to do the treatment. I don't care if it doesn't help, but I want to try it. And I said, okay, let's do that. He got fantastic results. Now, he wasn't 100%, but he could walk. He could do the things he wanted to do. He was ecstatic with where he was. And I honestly didn't think that I could help him even 10%.
We're going to take a quick break. We come back, more about the process. Now, I know you're offering like a special, $47
Right.
for an assessment, an evaluation, and a strategy session to get them out of pain.
Correct.
And that's a limited time offer, $47?
Nope, that's our permanent offer right now.
Okay.
That's what we charge for the initial assessment. And the reason we do that is to make it affordable so that patients that don't know that they can actually be helped like this by this type of treatment get that option to do that. So
Okay, good. We'll take a quick break. You're watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. We'll be right back.
Hi, I'm Kurt. I've been coming to Dr. Folkerts for several weeks now. I came in here with severe lower back pain, and when I first came in here, I could barely walk. And Dr. Folkert, after a couple treatments and everything, he got me walking again and doing good. And I can't thank him enough. Along with him and his staff have done an excellent job in taking care of me. And I would highly recommend to him and his staff to anyone. Thank you guys very much. Thank you.
I'm Sharon Funk. I live here in Sherman, and I've been going to Dr. Folkert for about 2 years. He saved my life. I'm a hairdresser, and I couldn't walk when I came the first time, and he corrected that. And now I'm having issues with the other foot, and he's working with it, and I can't say enough about him. And the girls, staff, they're awesome. So, thank you.
You're watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. Today's topic, it's a big topic, using lasers to treat pain. It's become mainstream. Medical doctors across the country are using lasers now on knees and shoulders and low backs with great results. With us, we have the founder of Laser Pain Centers of Illinois, Dr. John Folkerts. Dr. Folkerts, welcome back to the program.
thank you.
Now, let's move up to shoulders.
Okay.
How well do shoulders treat with this?
Actually, we love treating shoulders. We see fantastic results with shoulders, especially a lot of people with frozen shoulders. The laser will go to the inside, heals that tissue, and they get their life back. They can play tennis again.
Out of pain?
A lot of times out of pain. The range of motion is a big one with the shoulder because of the amount of movement that you've got to get back into the shoulder. So, if you're playing golf and you've got nerve impingement or joint impingement with the shoulder, it's almost impossible to do. So the laser, that's what helps that heal through there. So they're back on the golf course. They're back playing tennis. They're doing things with their grandkids. So it makes a tremendous difference there. It does a great job. So actually, I think you told me that you used
Yes.
one of the lasers on your shoulder, or we're going to have surgery.
It's a different kind
right?
of laser than what you're talking about. It was a very weak laser, a cold laser,
Uh-huh.
right? Which you're familiar with too.
Uh-huh.
And I was told by my orthopedic buddy, you're bone on bone, it's not going to help. Now, I don't know. This was like 10 years ago. And had a shoulder problem for 10 years. Couldn't go swimming, couldn't bench press. I did the laser, my cold at-home laser, and it couldn't have been placebo because I had it for 10 years. Did the laser, done. I'm at 100%, like 100% feeling better. And then years later, the other shoulder went bad from bench press and not stretching, and now it's fixed that. So do you have a lot of these stories?
Absolutely. We have.
Because I know you have to be
many
careful
patients.
with claims, I bet.
Yes.
Right?
Yes. And a lot of shoulders too are weightlifters. They've been lifting weights for 20 years and they get the degeneration and they're not able to. They're losing their losing their strength. They're getting weak in their shoulders and they can't weight lift. So we see a lot of those types of injuries also. And they're back in the gym. They're weightlifting. They're setting new records. Patients like that with those types of injuries, we do well.
Okay, now we've talked about knees, low back, shoulders, sciatica, things like that. So with your protocol, so you're doing the laser, but you're doing a few other things. Tell me about what you're doing.
Okay, and it depends on the specific condition. For example, if we have a neuropathy patient, a lot of times we'll do what's called Vasopneumatic Therapy, which is basically, looks like a big pair of pants that you put on. It's computerized, and it actually stimulates blood flow down to the toes. And that's one of the things that with treatment with neuropathy, we've got to not only treat the nerve damage, but we also have to address the circulation to the feet. If you don't address both of them, you're either not going to get results or they're going to be limited results. So we do extensive treatment with the Vasopneumatic Therapy, obviously the high intensity laser. We also have infrared heat therapy. And then we have 2 FDA cleared medical devices that a lot of times it will send home with the patients for the patients to actually do that part of treatment at home.
And what is that, like electrical stimulation type of a thing?
One of them is an electrical device, and it actually is a very specific electrical current that's sent through the legs, and it retrains those nerves, because those nerves are there, they're just not working correctly. They're firing pain signals, or they're numb, or they're tingling. This device specifically trains those nerves over a period of time so that they fire the correct pain signals. And one of the things that we'll see with some of our initial neuropathy patients that come in with numbness and tingling, and usually I'll warn them and say, hey, you may start to get some pain, but pain's good because that means now your nerves are working.
Is that right? Okay.
So we go from numb tingling to pain. That's a good sign. Now usually it doesn't stay pain, then it starts, the nerves are working and functioning correctly, and they're getting their movement back, they're getting their balance back.
Using the combination of laser, at-home therapy,
Vasopneumatic.
electrical things you're doing.
Absolutely, yes.
Okay.
And balance is a big problem with neuropathy, and probably, I mean, more than the pain or the numbness and tingling, the complaints we're getting from those patients is, I'm not able to walk. I mean, I'm falling. It's embarrassing. I don't go out to eat with my friends now because, you know, if there's stairs, or I'm afraid I'm going to fall, and it's embarrassing. It affects their life. It affects their self-esteem, affects their mood. So, you know, getting those nerves to correcting the balance is
I got to ask
thing.
you about plantar fasciitis, because you told me on the phone and I saw your commercial. How well does the laser and these other therapies work on that problem?
The laser works fantastic on plantar fasciitis. I mean, I've had patients over the years that have gotten 100% better, and we see that all the time with plantar fasciitis.
Like sore feet, can't stand, and now they can stand, and their feet aren't sore.
Absolutely. We see that a lot. And plantar fasciitis, one of the problems with is there's not a lot of other treatment options out there. So most of these people have been suffering for years. And for example, I had one patient that came in, he was even having trouble just walking, and he likes to hike. And he had a hiking trip coming up in the mountains with his son, and it was within a few weeks. And I told him and said, you know, we'll work with this, and I think we can get you to where you can go. I'm not sure if you're going to be 100% or not. He ended up going. He was 95% done, or improved at that point. Went on his trip with his son, was ecstatic with it. Doesn't have any more problems. So, orthotics, it depends on the patient. You know,
you smile when I say orthotics.
I do, and I'm not against orthotics. A lot of my plantar fasciitis patients have already done orthotics. They try that first. I would say probably 80 to 90% of the time I have a patient come in that has orthotics, I end up having them take it out. And the reason being, you know, if you've got a structural problem with your foot, fallen arch, orthotics are great. Even with low back pain, they can help and are great. If you've got plantar fasciitis, which is inflammation of the tendon in the bottom of the foot, you put an orthotic in there, depending on the orthotic, usually you're going to get more pressure on the bottom of the foot.
Hurts even more.
Which irritates it, and it hurts it even more. So the thing that we want to do first with any of our injuries is number one, correct the problem on the inside, or actually get it to heal. Then we can try orthotics or stretches or exercises. And that's one of the biggest mistakes that patients make.
Is it heel pain or in the soft part of the arch?
It's both. It can be either. It's the soft tissue that goes through the arch, and then it attaches to the bottom of the heel. Now, the most common area is the bottom of the heel, or the bottom inside, but a lot of people will get through the arch and pain through the arch there also.
Help me understand this, because look, there are pain management doctors that are injecting shoulders with like sugar, like in prolotherapy, or injecting it with some anti-inflammatory medicines, or cold needling. Same thing with the knees. And the people get better. It's like the body, you create this injury and the body kind of heals itself.
Correct.
Like it sends growth factors to the area to heal itself by just a needle injection.
Right.
Is that kind of like what's going on with the laser?
It is.
I'm trying to figure this out.
It is. And basically the laser, and how it works is it's stimulating those damaged cells to heal themselves. It stimulates the cell and the ATP in the cell to actually heal itself. And the example that I give with if I burn my arm and I laser half of the burn, that half of the burn is going to heal better and quicker than the other half.
Okay.
It's healing that. So basically when you've got tendonitis, you've got sciatica, that laser is going to the inside and doing the same thing with those damaged cells on the inside without damaging the skin. So we're not cutting through the skin. It doesn't hurt. We're not damaging anything, taking anything out.
And this is definitely a holistic approach, because look, medications, opioids, all these narcotics, etc., that, look, nobody wants to be on them, but if they work for you, you got to be on them, right? They cause constipation and brain fog and You're just not yourself anymore. So when you see people that are off meds, and you see it every once in a while, they must be ecstatic.
Absolutely. And that's one of the big things too, especially with the opioids. Even the patients that are in severe pain are not able to get them anymore. It's very difficult for medical doctors to prescribe those types of medications, and now they're in excruciating pain and they're looking for something else other than just covering it up.
Okay, good.
You know, so there's a lot more awareness of alternative treatments. Really not alternative anymore, but these laser treatments like we're doing, and the laser protocol to try to get away from the constant medications.
So neuropathy, it's great for back pain, knee pain, shoulder pain, neck pain. We haven't really talked about neck pain, but it does that. Now, insurance. Unfortunately, insurance doesn't cover this across the country. Medicare, Medicaid doesn't cover this. But you've lowered the prices, and you say you have financing. People are financing this all the time, even with bad credit.
Right. Yep. We have a financing option that's there's no credit check. There may be a small down payment, and then we can get payments as low as $150 a month or lower for this service. So there's no interest, there's no fees along with it. So it's a great way to be able to finance it. We also have some discount programs since the insurance does not cover also. So we've got many different ways as far as the financing.
So people are just tuning in. We're talking a lot about lasers, but you do this in a combination of with other medical devices that are cleared to be safe by the FDA. Some at home, in person, even some decompression things. You have a nutritionist putting them on anti-inflammatory diets if necessary. Is that right?
Yes. We always address the nutrition aspect, especially with neuropathy, but any of the treatment options. If you can change your diet enough to lower the body's inflammation, number one, you're going to feel better. Number two, you're going to heal quicker. So, and once in a while, we'll do a combination, especially with my knee patients. I'll have a lot of knee patients that come in and they'll say, you know, I've been recommended a knee replacement, but they can't do it. So, I mean, there's just a lot of patients that don't qualify for a knee replacement. And
because of their weight and things like that.
Because of the weight, their health, and there's no other option. So this does a great job at that.
We're out of time. I want to thank you for coming on the show.
Well, thank you.
Final message to somebody watching this. They pay a $47 for an assessment, evaluation, and then strategy to get them better. And that's what you're offering right now.
Absolutely.
Do they get to see you most of the time?
Absolutely. I'm the one that they're going to see when they come in. They've got nothing to lose if they want to get their life back. You know, we'll review everything, review all of their diagnostic tests that they've gotten somewhere else, go over that specifically in a strategy session, let them know, number one, if we think we can help them, and if we can, I outline the aggressive treatment plan specifics and go over all that with them.
Okay, good. I want to thank you for coming on the show. Good stuff.
Well, thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.